Hello, everybody. I'm Dr. Yair Maimon, and I would like, first of all, to thank the American Acupuncture Council for putting up this presentation. And today I'll talk on a very unique topic of menopause, on hot flushes, but in a very, I can say, different way, or I would like to highlight different points of how we treat and the potential of treatment of acupuncture for menopause and especially for hot flushes. So let's put up the slides first. Um, Menopause, it's to do with transformation always. It's a time of changes for women. It's a transformation. And when we talk in Chinese medicine of transformation, it's always something to do with yin and yang. It's always rooted in this constant transformation of matter into energy and energy into matter. Or we'll talk about transformation of Jing to Shen. And let's look a little bit about the uniqueness of the way in Chinese medicine the uterus, the womb is understood. If we look at chapter 47 and chapter 33 at the Suen, the simple questions, you will see that the uterus is connected on one side with the Bao Mai, with the uterus vessel to the heart, and on the other side with Bao Lao, with the uterus channel to the kidneys. So immediately the uterus is between two very specific organs, the heart and the kidneys. And as you know, the heart and the kidneys represent the water and fire. Or again, if we go deeper, we can say matter and energy. And the uterus is a place of creation and of birth between fire and water, or between earth and heaven. And fire and heart are connected to the Shen, to the spirit, and the kidneys are connected to the Jing. And the meeting of these two phenomena, the meeting of yin and yang, are creating new life, a new possibility of life. So the uterus in this way is perceived in a very deep way of connecting heaven and earth, of connecting the heart and the kidneys. And it's very much related to the earth in Chinese medicine, but also to these two organs, which are heart and kidney. And it means also when we are utilizing acupuncture points, and especially later when we look at some research on hot flushes, so there'll be some points related to the heart, like heart 7, the low point of the heart, pericard 7. And if you look at the kidneys, bladder 23, that tonifies the kidney, kidney 3, which is the again the source points, the yuan point of the kidney. So we see all these yuan points of the pericard, heart, and kidneys, and spleen 6, which is more related to the earth, where all the yin channels are crossing, and again has a very close link to the lower jaw and to the uterus. So this actually, I took these points, it's very common points, but they're also being used in research, which I would like later to present. But this is another way to show the logic of Chinese medicine of connecting the fire and the water, the heart and the kidney, and enhancing and reducing also side effects of menopausal changes. So menopause, it's always this movement of transformation of yin and yang. And we know the cycle in women of every 7 years of the cycle, and around 49 is the menopause time. By the way, the premenopause starts much earlier, so many symptoms can be much earlier than the menopause itself. In this lecture, I'm not going to talk on about the natural kind of menopausal symptoms and occurrence of symptoms, but more on menopausal symptoms and especially hot flushes, which are occurring due to anti-hormonal medicine. Anti-hormonal medicine is given to women who had cancer, and especially cancer which is sensitive. There is receptors on the cancer cells themselves which are sensitive to estrogen. And then the treatment is anti-estrogen treatment, especially in different cancers, either gynecological cancer and very common breast cancer. So endocrine therapy in Western medicine applies this anti-hormonal medicine, and because the tumors that are hormone related, if there is more presence of hormones in the body, there is more tumor growth. So this is the very common, as I say, in breast cancer and in several gynecological cancers. There's two major ways of endocrine treatment. One is to block the receptors on the cells themselves to estrogen. The other one is to stop the production of estrogen. This is a very common treatments like tamoxifen. If you see on the cells, there's the receptors for estrogen, and the tamoxifens mimic or has affinity and binds to the surface of the cell, and therefore the estrogen cannot bind to it, and therefore start the growth of especially mutated cancer cells. So this is the kind of competition idea. It binds to the receptors in the cell. So this is tamoxifen, and the other one is aromatase inhibitors. The estrogens, in order to become estrogen, they're going through different pathway of changes. One of them is the aromatase, and when the aromatase is inhibited, then there's no production of estrogen. There's different ways to block the production of estrogen. This is the very common one with aromatase inhibitor. The bottom line is very similar, is producing in women who are taking anti-hormonal medicine many side effects of menopause due to these medicines. There's many common side effects for women who are receiving endocrine therapy. I put here the most common one, like fatigue, hot flashes is a big one, mood swing, insomnia, sometimes even disturbance in concentration and depression. And there is a whole list of symptoms, of menopausal symptoms, which are reduced by the endocrine therapy. These medicines are taken for a long time, 5 years, sometimes for 10 years. And many women stop, almost 30% are stopping sometimes the treatment, even though it can be very useful for them because of the side effects. But acupuncture has been shown, and there is evidence that it's extremely effective treatment to reduce side effects, especially hot flashes and joint pain. In this presentation, I want to talk a little bit about the evidence that we have for acupuncture reducing the hot flashes, but also enhancing general better well-being in this woman. One of the early studies, but still I think one of the very inspiring studies, was head-to-head study. So women, breast cancer women, are taking anti-hormonal medicine were divided into two groups. One was receiving acupuncture, and the other one was receiving venlafaxine, which is like SNRI. It's a light antidepressant drug, but it has also it reduces also hot flashes, so it's commonly used also for hot flashes. And they measured the outcome. They gave a certain 12 weeks of treatment. Then the treatment stops, both the hormonal, the venlafaxine, so both the medicine and the acupuncture was stopped after 12 weeks, after 3 months. The women didn't receive any other treatment, and then they looked at the outcome even 1 year later. And the acupuncture group did extremely well, and obviously you will see the venlafaxine. As the women stopped the medicine, the effect was quite immediately reduced, and hot flashes were back. You're welcome to read the full study. I'm just giving some highlights. So as the results, you can see that both groups exhibit a significant decrease in hot flashes, depressive symptoms, and other quality of life symptoms. But in the acupuncture group, it was the same for the acupuncture and the venlafaxine. But by 2 weeks after stopping the treatments, the venlafaxine group had a significant increase in hot flashes, where the hot flashes in the acupuncture group remained very low. So this is very important because we are showing the effect of acupuncture as something that enhances the ability of the body to bring itself back to balance. So we are really talking about the quality of the healing qualities of acupuncture, which is lacking when you treat sometimes symptomatically, like in this case. And also in the Venla vaccine, it's also very commonly known as Vipax, had many adverse effects. There was nausea, dry mouth, dizziness, and anxiety. Within acupuncture group, the opposite. There was no negative effect, but actually there was some additional benefit, even increase in sex drive in some women. And most of them reported improvement in their energy, clarity of thoughts, and sense of well-being. So the acupuncture group had no side effects, the opposite, had other benefits comparing to the group that took the venlafaxine. So in conclusion to this research, the acupuncture appears to be equivalent drug to therapy in these patients, but it is safe, effective, it's durable for vasomotor. Vasomotor is this hot flashes, and secondary for long-term as also long-term use of estrogen and anti-hormonal estrogen use. The points that they used in this research were quite interesting. So the main points you can see, and I mentioned them before, was bladder 23, kidney 3, and spleen 6. So strengthening the kidney and enhancing also the all the in channels and the spleen. And this is the point that all of the practitioners use. And then there were secondary points that can be, according to TCM diagnosis, so the practitioners had some kind of freedom to choose which points are the most beneficial for the patient, so they could do a diagnosis, Chinese medicine diagnosis, and be more exact on what's going on with the patient. So if it was more heat and yang, they could do 14 or do 20. With the 14 especially can reduce a lot of heat, and especially if the heat goes up to the upper parts of the body. If there was qi deficiency like fatigue, stomach 36, REN 6, lung 9, and if there was more disturbances at night, dreams, sleep disturbances, gallbladder 20 and liver 3, or more agitation. By the way, many menopausal symptoms are to do with more blood stagnation, agitation, and if it was more to address the Shen, then pericard 7 and heart 7, and this is the points we discussed before. And it was for 12 weeks, so 4 weeks it was twice a week, and then another 8 weeks, once a week treatment. So the total treatment was for 16 weeks. And I would like to present another research, a larger research with 190 women, and they received 10 acupuncture treatment sessions. And again, both of this research was published in the Journal of Clinical Oncology. It's a very reputable journal. So it's in science, it's not just what you publish, but where you publish it. So publishing in such a journal has a lot of or additional weight to it, and especially if you want to present acupuncture evidence to oncologists or to the medical team, it's good to quote high reputable journals such as the Journal of Clinical Oncology. So this also had 10 acupuncture sessions. So this group was doing, as you will see, the choice of diagnosis and points was a bit more diverse than the first research, and there's quite a few research on that topic. I'm just presenting two. And they also followed up for 3 months and 6 months post-treatment visits. In both cases, we see this uniqueness that it's not just the treatment itself, but also when the treatment stops, we can still see even half a year and a year later the effects of treatment. Because many patients usually ask me, how long, do I need to come for acupuncture? Is it like a life thing? So I say, no, if you'll come for a series of treatments, then the benefit should last long. To me, actually, for many years, because if the acupuncture was accurate and the diagnosis was good, it has an effect which is a long-term effect. So again, here the conclusion that acupuncture is effective integrative intervention, which the quality of life and hot flashes for these women. They used a much more elaborated, and actually that's what I love about this research, a real TCM diagnosis, and Chinese medicine is a medicine. So, we don't just use points per condition, but we are trying to do a deeper diagnosis, understand better. And different women will have hot flashes depending also on their um, the condition they came with. So if they came with more yin deficiency, there'll be more the hot flashes and the quality of life impairment due to yin deficiency. So there was a set of points, and here they actually looked at the percentage of the diagnosis. So 16% of the women was diagnosed with kidney deficiency. I just highlighted the kidney points like 6, 3, 7, and 10 that they could choose put, but obviously also you see here heart 6, which is very good for heart and kidney deficiency. If it's kidney yin and yang deficiency, or kidney and liver yin deficiency with some yang rising, then again will be different points. So there'll be still the kidney 6, pericard 7 as a kind of major points to balance the kidney and pericard of fire and water. But we'll see here additional points like liver 3 and gallbladder 20, and maybe combination of liver 3 and large intestine 4, maybe to move the stagnation and enhance better the liver chi, and liver 2 to reduce heat from the liver. So you see the point combination here as a different, as a different dynamic, including lung 7 and kidney 6, which is the opening the renmai, the channel in front of the body, which is responsible for all the yin. And then if it's kidney and heart disharmony particularly, then you will see this group of points, there'll be more kidney points from kidney 6 to kidney 2. Kidney 2 is one of the interesting points that can take back the heat into the kidneys and enhance the kidneys. So it's not just reduces heat, but also enhances the kidney yang energy. And additional point, we'll see pericard 6, heart 6, that we discussed for the yin of the heart, so and pericard 6, with each additional ability also to be the main point of the yin weimai, balancing all the yin in the body and enhancing the heart womb kind of balance. So also hormonally, there will be much more enhancement in using these points. And additionally, in this group, you see many other points that are to do with enhancing kidney and also relaxing points like on the Dumine, CV15, because the heart is so much involved. And as you can see, there's like 10% of patients in this group, with 36%. So you see most of the patients were of kidney and liver insufficiency. So they were more coming from this group. From phlegm stasis, phlegm of chi stasis, there was still, it's a very different diagnosis. You'll see that we'll have some other points like stomach 40, spleen 10. So more looking at this dynamic of a phlegm and chi stagnation, additionally to kidney and heart points. So, and blood stasis, interestingly enough, there was none in this group, but still in clinic, when we look at the symptoms, sometimes the symptoms is also very common and seen commonly. I would like to say that one of my passions is to teach the treatments of cancer patients, and especially to treat oncology acupuncture. And we do a very extensive course at the TCM Academy. And the idea is to teach and give the tools, but also the skills and the competencies to treat cancer patients, and especially cancer patients who are having side effects. And we combine the three pillars of Western medicine, Chinese medicine, and research and evidence base. Because when we combine these three pillars, I think then there is a much clearer understanding both of the symptom, the ability to communicate with patients, and also the medical team that is working with the patients. And in cancer, it is extremely effective, extremely effective, but extremely important to understand both the Western medicine and the Chinese medicine differentiation, which is very relevant to cancer patients. So if you want to know more, you can check up at the TCM Academy website. And this is this extensive oncology acupuncture program, which covers, there's also in the website a lot of other free stuff, but covers also other ideas like pain, nausea, vomiting, fatigue, and other components which are has so much evidence to treat cancer patient and to treat the side effects. So I hope you learned something about the treatment of hot flashes, the evidence base behind it. And with this slide, I want to wish you all the best of health. And from Shen to Shen, thank you very much for listening and being with us. And again, I would like to thank the American Acupuncture Council for putting this up. So all the best and thank you so much.